Hey there, let's solve some questions on this topic.
Okay, let's look at the questions and then try and solve it, and it might help us for the test. Okay, so question one. Question one tells us that what genetic condition is associated with a lack of functional LDL receptors on cell membranes? So what is the answer for that? So the answer is that the genetic condition is Familial Hypercholesterolaemia, so FH, and it is caused by defective or absent LDL receptors, and this results in markedly elevated LDL cholesterol levels and premature atherosclerosis. Let's look at question 2. So question 2, list the 4 major acquired risk factors for atherosclerosis mentioned in the material. So for any of the material could be like the notes that we had or any case study that's presented, and the answer for that would be hypercholesterolemia, smoking, hypertension, and diabetes mellitus. Let's look at question 3. According to the material, what is the 2-step process in the pathogenesis of atherosclerosis? And the answer is the pathogenesis occurs in 2 main steps: endothelial damage or injury, and then the other one is the vascular wall responds with lipid accumulation, inflammation, and smooth muscle cell proliferation. Now let's look at question 4. So question 4, what are lipid-laden macrophages called, and what happens to them as plaques progress? And the answer is lipid-laden macrophages are called foam cells. As plaques progress, these foam cells undergo apoptosis, releasing lipids that contribute to the formation of the necrotic lipid core. Let's look at question 5. So for question 5, what are the 3 main components of a fully developed atherosclerosis plaque? And the answer is a mature atherosclerotic plaque consists of a central lipid-rich necrotic core, a fibrous cap, and endothelial covering. Let's look at question 6. So question 6, what is a fatty streak and what is its clinical significance? So the answer here is a fatty streak is an early atherosclerosis lesion composed mainly of foam cells, and it is considered the precursor to advanced plaques, but it is clinically insignificant because it does not obstruct blood flow. Now let's look at question 7. So what are the key characteristics of a vulnerable plaque that make it high risk? And the answer is a vulnerable plaque has a thin fibrous cap measuring less than 65 micrometers, a large lipid core occupying more than 40% of the plaque, prominent inflammation, and these features make it more likely to rupture. Let's look at question 8. So question 8, what process leads to the formation of a fibrous cap in an atherosclerosis plaque? And the answer is the fibrous cap forms through the migration of proliferation of smooth muscle cells which produce extracellular matrix proteins, particularly collagen. Let's look at question 9. So question 9, at what percentage of lumen stenosis does critical reduction of blood flow typically occur? And the answer is critical reduction in blood flow usually occurs when there is a greater than 70 to 75% narrowing of the arterial lumen. Question 10. So question 10, what is the primary cause of stable angina pectoris in the context of atherosclerosis? And the answer is stable angina is caused by a fixed atherosclerotic plaque that narrows the coronary artery, producing reversible myocardial ischemia during increased oxygen demand, such as exercise. Now let's look at question 11. Question 11, what is the immediate consequence of plaque rupture in terms of thrombosis? And the answer is plaque rupture exposes thrombogenic material leading to platelet aggregation and thrombosis formation. Now question 12, how does embolisation from atherosclerotic plaques commonly cause stroke? And the answer is thrombosis fragments from carotid artery plaques can embolize to cerebral arteries, causing an ischemic stroke or transient ischemic attack. Question 13. What is a ruptured abdominal atherosclerotic aneurysm, and what is its fatal consequence? So the answer is, it is the rupture of an abdominal aortic aneurysm caused by atherosclerosis. The rupture results in massive internal hemorrhage and hypovolemic shock, which is often fatal. Question 14. Which class of drugs are cholesterol-lowering agents that inhibit HMG-CoA reductase? And the answer is statins are HMG-CoA reductase inhibitors that lower LDL cholesterol and reduce cardiovascular risk. And then question 15. How do low doses of aspirin help in the management of atherosclerosis? And the answer is, low-dose aspirin irreversibly inhibits COX-1, and this reduces thromboxane A2 production, and this decreases platelet aggregation and lowers the risk of arterial thrombosis. Thank you for watching this video. Really hope it helps you, and hopefully one day we can become good doctors. Bye.